What are AMD symptoms? Well, in its early stages, age-related macular degeneration, or AMD, doesn't have to cause any symptoms. It can be asymptomatic, and often people are warned or told they have the condition when they see their optician or optometrist on the high street. As the condition worsens, we see more accumulation of waste material underneath the retina, and this can start affecting our vision in very subtle ways to start with. Perhaps problems when you're out at night or at dawn, problems seeing things at dawn and dusk and in poor lighting. Perhaps a slight difficulty when one is reading, or difficulty with driving and perhaps recognizing faces. So in the early stages, the symptoms can be quite subtle. As macular degeneration progresses, it can cause worsening symptoms, such as symptoms of distortion, where images look bent or crooked, and people can develop increasing difficulty recognizing detail, and indeed with reading as well. And finally, in severe or advanced cases of age-related macular degeneration, or AMD, people actually have a loss of their central vision, a blind spot, if you will, which prevents them using their straight-on vision for everyday tasks. But they still usually have their peripheral vision intact, allowing the ability to navigate and see things at the edge of our visual field. Age-related macular degeneration can progress at different rates. The underlying condition is the dry form of the disease, where patients develop a progressive thinning of the retina. And some patients can develop reasonably rapidly over a few years to have symptoms, and other people can remain stable perhaps over 5 or 10 years. And at the moment, we don't have all the answers to why some patients progress rapidly and other patients progress slowly. In addition to that, at any point along that pathway or spectrum of dry age-related macular degeneration, patients can develop wet AMD. And in wet age-related macular degeneration, fragile blood vessels grow into and underneath the retina, and they can cause quite a sudden loss of vision. And that can happen over days or perhaps over a week or two. And in its earliest form, wet age-related macular degeneration can cause symptoms such as distortion, which is why we always advise patients to be seen quickly within a week or so if they develop such symptoms. Finally, in terms of the end stage of the condition, again, patients report a rapid loss of central vision with forms of the disease such as wet age-related macular degeneration. And that's why it's important to be seen before that end stage develops, because the condition becomes untreatable if there is permanent loss of central vision.